joining us there from London. The big question, of course, is this mutant of the virus really more deadly? Will vaccines work against the mutant? Is the mutant present in India? What curbs are really necessary? Just some of the questions I want to pose, because I'm joined by India's leading vaccine scientist, Dr. Gagandeep Kang, Professor Microbiology, Christian Medical College, Vellore, joins me. Appreciate your joining us, ma'am. Fresh wave of panic with reports of a new strain of coronavirus being reported from the United Kingdom, flights now being cancelled to and from the United Kingdom. How serious is the situation? Could we have a strain that some are suggesting could be much more virulent than the original SARS-CoV-2?
Well, there is a new strain that has been detected in the UK. It's a variant, actually, which is under investigation at the moment. Some of the mutations that are seen in this strain have actually been around from April. What is unusual about the strain is the number of mutations that we are seeing in the spike region of the virus. And what this might mean, we don't know for sure, is that this virus might be somewhat more transmissible than the previous strains that we have had. We might see that this can spread more easily. We don't know this as yet, but it's a possibility. It's also possible that this strain might cause somewhat more severe disease because it replicates better than other strains. At the moment, these are concerns that are only based on sequence data. And we have some epidemiological data from the UK showing that this strain is spreading very fast and is replacing existing strains that were there previously, particularly in the last month. Is this a significant concern? Until we have more information, that can be quite hard to say. But it's important to remember that with all RNA viruses, a lot of mutations do arise. Some of them have consequences, many don't. Our best approach at this time is to make sure that in India, we sequence as many strains as possible, see whether we actually have this variant in our country as well. It would be useful to screen recent travelers from the UK, for example, and then wait and watch to see what happens with the strain in other parts of the world. It is a concern, but there is absolutely no need to panic.
You know, you're saying there is no need to panic, but is it unusual that such variants should emerge barely months after the original one? Is that unusual, or do viruses, as is being suggested, these are mutants that, they will mutate, and perhaps some variants could be more deadly than others? Is that how you see it? Therefore, not unusual at all?
It's not unusual for RNA viruses to mutate and for new variants to emerge. In fact, I've heard that there is a lot of discussion that this has emerged in the UK and in South Africa. Even though the UK variant and the South African variant do share some mutations, it's important to remember that these are not identical strains. They have emerged separately. This just goes to show that these kinds of variants emerge very frequently, and it's only if we match the genetic information with the epidemiological information and the biological information that we will be able to understand what these strains mean. At this time, we have a lot of genetic information, we have some epidemiological information, and very little biological information. Let's put all these pieces together before we decide how much of a threat this can be.
What are the chances, though, Dr. Kang, that this strain of virus is already in India? Is it 50%, 60%? Is it possible to put any percentage Is this all in the realm of conjecture that a similar variant could already be spreading in India, given that our numbers are pretty low of the daily cases we're adding?
Viruses travel with people. So since we have had travel from the UK to India, it is very feasible that we may have some people who are infected with this virus who have traveled during this time. Can I put a percentage on it? No, I cannot. Zero, it may be a lot more than that. But until we get sequence data from the viruses that are currently circulating in India, we will not be able to say whether the strain is here or not. Indian scientists have sequenced well over 4,000 strains of the virus, but I think we need to have an ongoing sequencing strategy where a certain proportion of strains are sequenced on a regular basis. I understand that the government is setting this up, and we will have answers for this very soon. So whether the strain is in the country, we will know soon from data in India.
It is being said, though, Dr. Kang, and I'm quoting the British Health Secretary, Matt Hancock, he says the new variant is out of control. The suggestion is that it is 70% more transmissible. Is that also pure conjecture? And importantly, will antibodies that may have been developed through earlier COVID-19 infections be effective against a mutative coronavirus?
So let's break that down. What does out of control mean? It means that the UK is having lots of cases of coronavirus that are spreading quite rapidly in the UK, and this strain makes up a major proportion of those. Is that because of the virus, or is that because of the behavior of the infected individuals? So far, we know that the virus started out in younger people and is now being seen in elderly as well. So this indicates to me that at least some component of the spread is probably related to the behavior of the individuals. Now, in terms of the 70% more transmissible, at least some of the information that we have seems to indicate that this virus might be more transmissible. Now, does this happen often? Well, you may remember that we had another strain called the D614G, which also emerged about 6 months, emerged in February, and then very rapidly became the dominant strain around the world, including in India. That is a strain that is more transmissible than the parent strain that was seen in Wuhan. So this is not an unusual phenomenon. Strains, variants do emerge, mutations happen with RNA viruses all the time. But rather than worrying about just the genetic information, we should be thinking about what this means in terms of spread and what this means in terms of severity of disease. The other component that you brought up is what does this mean for vaccines?
Yes, for
Now,
those
if
with
you have a mutation in a protein, that would matter a lot if you were, for example, relying on only one antibody to prevent infection. But when we make a vaccine with the whole spike protein, which has lots of antigenic epitopes, lots of little pieces of protein that are recognized by antibodies. So we are not dependent on one antibody alone. We are dependent on a number of antibodies to provide protection against the spike protein and thereby block the infection of the virus into cells. Now, when you depend on multiple antibodies and one doesn't work, then the others will still work. So I don't think, with the mutations we've seen so far and the antibody responses we know that vaccines are inducing, at this time, we do not need to worry. But in the future, if there are still more mutations, then perhaps we will need to think about modifying the vaccines so that we address the new structure of the spike protein. With the mutations we are seeing, we do not need to worry.
Let me therefore try and simplify it for our audiences if possible, because net, are you telling me, Dr. Kang, that the entire vaccine rollout, which is already taking place in the US and the UK, Pfizer, Moderna, or hopefully in this country in the future with Oxford, Bharat Biotech or Sputnik, all of which are going through various stages of trials, that these vaccines will be effective against the new mutant, but only on the assumption that there aren't further mutations. Am I correct?
That is correct. Based on the evidence we have at the moment, I think it's extremely unlikely that the vaccines we have currently will not work against this strain. But we need to track the strain very carefully, and especially in people who get the vaccine and for whom the vaccine does not work, in that they get infected. The viruses from them will be very important for us to study to figure out what the virus is doing when there are antibodies that are directed against it. So that will give us quicker clues about how we might need to think about modifying vaccines.
Also, therefore, and again, I want a clear understanding of this for our viewers. If I have already had coronavirus in the last 9 months, recovered, presumably there is less possibility of getting reinfected by the new variant. Am I correct? Because the antibodies are in place?
Right now, if you've had coronavirus recently, you will have made lots of antibodies to the coronaviruses. And if this strain comes around, just like with other strains as well, you are likely to have some degree of protection. How long this protection will last, we don't know yet, but it's extremely unlikely that you will have no protection at all.
The government is saying in India, Dr. Kang, there is no need to fear. But you've got Maharashtra with night lockdowns now, and flights being suspended from UK. What else can governments do at the moment to deal with this new variant?
I think expanding our sequencing capacity and having a strategy for ensuring that we get as much sequence information about the virus in a sustained manner. We should continue to track this virus, what exists today, as well as what will emerge in the future. All of this just highlights that what we need to try and do are the two things that we have been doing. One is to prevent the spread of the virus by ensuring that we test widely and we track and isolate. We have to try and suppress the virus in the community, really try and reduce the numbers. And the second is to try and protect as much of the population as possible by using safe and effective vaccines. And those are pretty close on the horizon. Situation in India right now, because our cases are declining, but that doesn't mean that we can afford to take it easy.
You know, that is reassuring, Dr. Kang, but let me ask you, Christmas and New Year coming, there was hope that 2021 will be better than 2020. People looking forward to festivities. But look at what is happening. London again under lockdown. Most of Europe also threatening to go under lockdown. Will that happen in India too, in your view? Do you believe the worst is over? Or is, dare I say, the worst yet to come?
I think 2021 will be significantly better than 2020 because we know so much more and we have so many different tools in our hands. Whether that is vaccines or it is good testing strategies, systems for sequencing, we really, the development of monoclonal antibodies, we have lots that is available to us that we did not have during 2020. I think we can look forward to 2021 to really being able to control the virus if we follow good public health norms and use the best of our science and technology.
Dr. Kang, as always, thank you very much for sharing your wisdom and in a way, tempering down the panic that seems to have set in with this new virulent COVID strain, as some are calling it. Thanks again for joining me and wish you a very happy new year.